we've been over this again before. How do you get epidemics? Let's start with the bottom one to start. It's one of those things that's like the oldest trick in the book. You get an epidemic to start by getting illnesses which have very similar characteristics, so-called separate diagnoses: scarlet fever, herpes, shingles, chickenpox, allergic reactions, dermatitis, measles, rubella, impetigo, erythema multiforme, and you call them all chickenpox. And this goes back to what I described from medical school. I distinctly remember sitting in rooms where dermatologists and pediatricians would come in the room and show slideshows of different rashes. So one was herpes, one was scarlet fever, shingles, chickenpox, and they would have mostly indistinguishable clinical characteristics. They had some fever and they had some mucus and they had some spots. And then they said, well, you can see here's the spots of scarlet fever, and here's rubella, and here's impetigo. And I remember sitting there thinking, I don't really see the difference. Obviously, in the horrible ones, you could see that there was a difference, and some of them have more bubbles, and some of them were flat, and some of them were irritated, and all that. But then they would tell you that this is not a particularly characteristic reaction. In other words, there's many different ways that each of these can manifest. So just because you see one that has blisters doesn't mean they all do with herpes or chickenpox. So all you do is you lump them all into one and you call all of those monkeypox, because there is no gold standard to differentiate the two. And as I've also said many times, there are many published studies over the years where they attempted to prove this by showing experienced pediatricians, 10, 20, 30 people with different rashes, and they say blindly which one is which, and they cannot agree, which means they have also no way to tell. And so they basically just guess. And that's pretty much what I did in the early part of my practice. People would often come and say, what is this rash? And I knew that I had no way to know it, but I was working in the ER maybe at the time, or sometimes in my private practice. So I just made it up based on what I was told was going around and some guess that I made. I'm not necessarily proud of that, but that was the only way I could see doing it. And when I would ask colleagues in the ER, how do you know this is this? They always said, there's no way to know. So that's how you get an epidemic. And then how do you get an epidemic to end when you've allegedly eradicated smallpox with a so-called vaccine? You just start calling it all these different names: chickenpox, shingles, herpes, etc. They did that with polio, and it became acute flaccid paralysis and Guillain-Barré, etc. And when you want the polio epidemic to start, you call all those things polio. When you get a vaccine, so-called, and want it to end, you separate them. And it's one of those oldest tricks in the book. And so that is seemingly what is going to happen now with monkeypox, which I'll talk about in a minute. So that was a new slide. I'm sure we've been through this and we've heard about it, but this makes it very clear how you do that.